Should you use estrogen cream for anti-aging purposes? This is a question I get all the time, and actually the answer depends on a number of factors, and we're going to tackle those today. So hello there, my friend. I am Dr. Ray Hamidi. If we have not met, I'm a board-certified dermatologist. I have been treating aging faces for 15 years, and estrogen is really kind of a hot topic these days, not only amongst consumers, but also among dermatologists. And the truth is that in the dermatology world, there is actually a lot of debate about this topic. And the reason for that is because there is not a consensus among us on whether estrogen is actually beneficial and if it outweighs the benefits outweigh the risks when it comes to using it for anti-aging purposes. Not in the way, for example, that there is a consensus amongst us for sun protection or retinoids. Pretty much across the board, you will see dermatologists agreeing that everyone should do good sun protection to protect against photoaging, which is signs of aging on the skin from UV radiation, and also from protecting from skin cancer. And that retinoids, across the board, we agree that it is the GOAT of anti-aging, the greatest of all time of anti-aging topical treatments, and that pretty much everyone should be on them if they can tolerate them. So if you ask one dermatologist about estrogen, they might say one thing, yeah, go ahead and use it, great. And another one might say it's totally not worth it. Okay, so why is that? The simple truth is that the studies, the clinical studies, the evidence behind topical estrogen use for anti-aging purposes are few. And while they do trend toward showing an improvement in signs of skin aging, like hydration and fine lines and elasticity and that kind of thing, we definitely need more studies, including more high quality studies, to confirm what we think may be true. And then when you factor in the nuances of exogenous estrogen, and when I say exogenous, I mean estrogen that is not produced by your body. So when you factor in the nuances, including the effects of estrogen on breast tissue and endometrial or uterine tissue, and its effects on cardiovascular health and risk, then it becomes even more complicated, doesn't it? Okay, so why are we even talking about estrogen? What is estrogen's role in the health and the beauty and the youthfulness of skin? What does it actually do? So there actually happen to be a lot of estrogen receptors on skin cells. And when estrogen binds different skin cells, it has different effects. The main effects in the skin that we care about are that it increases collagen and elastin production. It increases production of hyaluronic acid in the dermis and that second layer of skin, which helps hydrate your skin and help your skin stay moisturized. It affects sebum or oil production, and so it can actually help regulate oil production in a way that is also keeping the skin more hydrated and also preserving the barrier function of the skin. Sebum is important for the barrier function, meaning keeping bad things out and holding good things in. And so it does affect the barrier function as well. It also has an effect on the blood vessels such that it can bring more nutrients into the skin via the blood vessels. And in that way, it also helps with wound healing. We know that as well. So it's not too surprising that around perimenopause age, which that will vary for everybody on when that actually starts, when your estrogen levels are kind of starting to decline. And maybe you have some symptoms of that, maybe you don't. For some people, it's in their late 30s. I would say more commonly, it's in the early to mid 40s. And you might have some subtle signs happening, like some trouble sleeping, some irritability, basically the same signs that you get in menopause, which is kind of not as robust maybe and not as complete of a picture. And so it might not be quite evident what's going on. But this is around the time, perimenopause and definitely in menopause, when a lot of women start to notice really significant changes in their skin. And you tell me if you've experienced this as well. Changes like a loss of elasticity, meaning the skin is starting to sag a bit more, and fine lines starting to hang around. Even when you're not smiling, they're still hanging around the mouth area, around the eye area. You drink tons of water, you're putting lots of moisturizer on, and it's still there, right? Your skin might actually feel more dry, a bit more dehydrated. It might start to feel more itchy because of that reason, and also more sensitive. So again, remember I said that estrogen helps maintain your skin barrier, its function. And so when your barrier is not functioning as well, it's not keeping irritants out as well. And so things that never actually bothered your skin might actually start to bother your skin all of a sudden, like your moisturizer that you've used for 20 years might all of a sudden start to irritate your skin. And you might notice even sometimes overnight, it seems like it happens, some crepiness to the skin, deep folds, a little bit of waviness to the jawline that you didn't have before, maybe even easier bruising because estrogen does help that collagen support around our blood vessels as well, so that can happen. So it's not a coincidence that all of this starts to happen really at an accelerated pace when our estrogen is also plummeting. Okay, so now that we know the effects of estrogen on the skin, you might have heard all of that and thought, okay, why am I not using estrogen on my skin immediately? Give it to me ASAP. I want it right now. Or maybe you want to take hormone replacement therapy in the form of estrogen and progesterone that's given systemically. Okay, so why isn't just everybody across the board on estrogen once they hit their 40s? Well, not so fast, because as with everything in medicine, there is nuance, right? And actually, that's a huge reason why I'm not a fan of people getting their skincare advice or even their general medical advice online, on social media, even on YouTube, etc. There's so much nuance lost when you're trying to educate the masses, and you're losing that individualized support that is so important when it comes to treating our bodies, including our skin. Okay, but despite all that, I will try to tease through some of the nuance here with you, and I hope it helps you. And so before we talk about topical estrogen, I'm gonna dive into hormone replacement therapy a bit, and that is, of course, when you take estrogen, typically with progesterone, systemically. And it is true that just as hormone replacement therapy can reverse some of the systemic signs of menopause, like irritability, hot flashes, of course, trouble sleeping, maybe trouble losing weight as easily as you used to, those kinds of things, trouble building muscle, all of that, that it can also reverse some of the skin symptoms, specifically hydration of the skin, bit of plumpness, less sensitivity, irritability of the skin, and it can actually, yes, slow down the advanced signs of aging, like wrinkles, sagging, that kind of thing. Now, I will say, in terms of setting expectations, if you're at a stage where you already have, deep wrinkles and sagging and all those things, that just going on hormone replacement is not going to reverse those things, okay? It'll definitely slow them down, and you will definitely notice, for most people, I shouldn't say definitely notice, I guess there's nuance here. Everybody's bodies react differently to what is given to them. But in general, people notice an improvement in the quality of the skin, the hydration, that kind of thing. But again, the advanced signs of aging typically are going to require some more intervention in the form of the professional treatments to actually reverse those, okay? So again, hormone replacement therapy sounds amazing, and it actually is. The effects are so massively beneficial, especially for someone suffering from menopause symptoms, both internally and on their skin, right? So why doesn't everyone just go on hormone replacement? It's not for everybody, right? As with anything, there are risks involved. It's a matter of weighing the benefits versus the risks for your particular situation, and this is something you would speak with your physician about. For example, if you have a history of breast cancer or uterine cancer or cardiovascular disease, estrogen can have an effect on those things, a detrimental effect. And so it is really important, again, to have a detailed discussion with your physician. Typically, it's going to be your primary care doctor or your gynecologist, whether hormone replacement is right for you. Okay, so what if you're not on hormone replacement therapy and you don't want to take it, or you're just not a candidate for it, right? Is topical estrogen, now applied in a cream form, just as good in terms of the benefits on the skin? So this is where clinical studies and data become important, okay? Because as with anything, we can assume that, yeah, the skin has these estrogen receptors, and we are deficient in estrogen in our skin. And so, of course, if we put it on, it's going to be so amazing and do all the things, right? But yeah, that's a good theoretical thought, but we really need to study that to see if it actually happens. So has this been studied? The answer is yes. But again, the studies are few in number. Some of them are not super ideal studies like randomized controlled trials in large groups. They're just not. And so we kind of have to go off of the data that we have and then weigh that data against our own desires and our own, risks and that kind of thing. So the data does suggest an improvement in the skin when we use topical estrogen on things like skin hydration, firmness of the skin, on fine lines a bit, and then on collagen production. However, there is a lot of variability in the data. For example, in some studies, the cream was tested on non-sun exposed areas like the hip or the buttock. And then in other studies, it was applied to sun exposed areas like the face or forearm. And it does appear, when you look at those studies, that the effect of the estrogen, the beneficial effects, was more robust on the non-sun exposed areas like a hip or a buttock, versus the sun exposed areas like the face or the forearm. And so, of course, we don't love to hear that because where are we usually using it, right? Face, maybe neck, maybe backs of the hands, the more sun exposed areas. So again, it suggested an improvement in those areas, but definitely the effect was more robust when you put it on the non-sun exposed areas. And we don't really know the reason for that, to be honest. The sun exposed areas are responding to external factors differently than the non-sun exposed areas for unknown reasons. So again, there is some evidence to suggest benefit of it, right? But the reason that not all dermatologists across the board recommend estrogen for everybody topically is that, we just need more evidence to really do that. Can it be a helpful adjunct? Yes. And in a moment, I'll kind of speak to that again. But it's just not something that, for example, like using sun protection or retinoids, pretty much across the board, we're like, yes, do it. Okay. So that's the nuance there. And when you are making that personal decision of whether to use estrogen cream or not, and of course, in discussion with your physician, then you're really looking at the benefits, the potential benefits of it. And then you weigh that, of course, against the risks. And so what are the risks? Let's talk about that. The nice thing is that topical estrogen in general, fairly well tolerated. It really doesn't tend to cause irritation. Now, of course, any cream applied to any person can cause irritation. That's kind of the caveat there. But in general, if you're comparing it to other products, it tends to be fairly well tolerated. Now, there is the question of whether estrogen can actually worsen melasma. Melasma is a condition of the skin where you get dark patches on the skin, and it is a very estrogen responsive condition. It is actually exacerbated by things like hormone replacement therapy and also birth control. And also sun is a huge factor when it comes to melasma. But yeah, this hasn't really been well studied, but again, there's this theoretical risk that we know that estrogen internally can make melasma worse. So can it make it worse topically as well? Possibly. So if you do have melasma, you really want to think about this a bit more. And then also anyone with background blood vessel dilation on the skin, for example, with rosacea, that's kind of the hallmark of rosacea is dilated blood vessels in the skin. And so if you have that, again, estrogen, remember I said, causes more proliferation of the blood vessels and dilation, and that's actually how it helps deliver more nutrients to the skin, and especially in the wound healing phase. But again, there's a question of if you have rosacea, especially if it's poorly controlled, I would say, should you use estrogen? Is it going to make it worse? Is it going to make the flushing and the blood vessels worse? Again, not very well studied, but it's kind of theoretical risk, and it's something where you would approach topical estrogen treatment a bit more cautiously in that situation. So now let's talk about the elephant in the room, which is, does estrogen applied topically get absorbed into your bloodstream? And if so, is it to a degree where it's going to affect you or have potentially negative effects in terms of, for example, breast cancer risk? So the good thing is that this has been studied to some degree, not definitively. There's no clear yes or no answer here, which is why, again, discussion with your physician is so important. But there's some studies we can go off of, okay? So the first is a study where topical estrogen was applied in one area, for example, let's say the forearm, and they saw the benefits of the estrogen on the skin in that area. But they also saw benefits in distant areas, for example, like the face, like the hydration and, improved texture, that kind of thing. And so that would suggest, although it wasn't directly measured, it would suggest that estrogen is getting in systemically, internally, if it's able to also affect the face. Now, who knows if that's true or not, because again, they didn't measure the blood levels of estrogen in that study. Maybe, for example, there could be some correlation effect where the people who were treating their arm with estrogen also were being a little bit more diligent about using their moisturizer on their skin and kind of their sunscreen and all the things. And maybe the effect was from that and not necessarily the estrogen, who knows, right? But I would say that's one kind of data point to go off of, right? There was another study that was done actually using topical estrogen vaginally, which is usually how it's traditionally used, right? So treating symptoms of vaginal dryness that come about with menopause. So in this study, they looked at people with a history of breast cancer who were on anti-estrogen therapy, who were using estrogen cream on their vaginal area. And in those women, they saw that there was no increased risk of recurrence of the breast cancer, and there was no increased risk of mortality in the people using the estrogen cream versus those who were not. So that is reassuring data, but even the investigators there said, yes, we need more studies, etc., which is kind of the theme across the board, isn't it? We need more studies on estrogen use topically for anti-aging purposes. And, hopefully in the future, we'll have a bit more answers. So given all of that, I would say if you are someone who wants to do more for your aging skin and you think you might be a candidate for topical estrogen, that you speak to your physician about it. Because remember, topical estrogen is not available over the counter. It does require a prescription in most countries that I'm aware of, okay? So it does require discussion with your physician. And I do recommend you talk to your real life physician, meaning they do have some direct to consumer sites where you can get topical estrogen, but I would say if it's your first time taking it or using it, it's probably better to talk to your physician, your regular physician who knows your history well, and they can also be the ones to monitor you for safety and all of those things, right? So talk to them and see if it's something that would be right for you. Okay. Now, I will say do not use topical estrogen. I don't think you would, but just to reiterate, don't use it in place of good sun protection, in place of the GOAT of anti-aging, which is retinoids. View estrogen as an adjunct to the things you are already hopefully doing. Really good sun protection, hopefully a retinoid, which is again the GOAT of anti-aging topical treatments, greatest of all time. If you can tolerate it, do not listen to the voices out there saying not to use retinoids, that they ruin your skin. It's not true when you use the right retinoid for your skin coupled with the right other ingredients, and sometimes that's all it takes to get the benefits and not the side effects, okay? So sun protection, retinoid, topical antioxidants like vitamin C, and lastly peptides, in that order, are really the best studied in terms of preserving the health and youthfulness and beauty of the skin, okay? So you would view estrogen as an adjunct to all those. I would not replace any of those things with estrogen. But again, if you want to do a bit more, it really can have beneficial effects on the skin for a lot of people. Again, based on the studies that suggest that, and then also just having seen its use in patients and also in myself. I use it topically myself as well. I love it. So I hope that was helpful. If you have any questions, please pop them in the comments below. I love talking about this stuff. If you're not subscribing already, please do. This is a new channel and I just would love for you to subscribe. It would mean the world to me. If you have anything else you want to hear about on this channel, please just let me know in the comments as well. And I have had a lot of people asking me about my program, Radiant by Design. We are closed for registration now, but you can get on the priority list so that you can be the first notified when we reopen our doors for the next round. We do take a limited number of women, so you would have first access on the priority list. You'd also have first access to a significant discount on the program and exclusive bonuses as well. So if you want to get on that list, just click, I'll put the link to join in the video description below. Okay, I hope that was helpful and I hope you have a wonderful day and I will see you next time.